How can you make a finger splint at home? Have you ever found yourself in a situation where you need to care for an injured finger but lack professional medical help? Knowing how to make a finger splint at home can be a lifesaver. Let's walk through the steps together so you can be prepared. First, assess the injury. Look for signs like swelling, deformity, severe pain, numbness, or discoloration. If there is heavy bleeding or an open wound, control that bleeding first with a clean cloth. If the finger appears severely deformed or you suspect a fracture, splinting is essential to prevent further movement until you can get medical assistance. Next, gather your materials. You will need a rigid object to act as the splint. Some good options include a popsicle stick, a tongue depressor, a piece of cardboard, a gift card, or a small flat piece of wood or plastic. You will also need padding material like cotton balls, gauze, cloth, or any soft fabric. Additionally, have tape, strips of cloth, or any adhesive material ready to secure the splint. If you have scissors, keep them handy for cutting tape or padding. Now, prepare the splint. Cut the rigid object so that it extends beyond the tip of the injured finger and past the first knuckle or joint closest to the hand. This length is important for proper immobilization. If needed, slightly mold or curve the splint to fit comfortably around the finger. Once you have your splint ready, apply padding. Place the padding between the finger and the splint to avoid direct pressure on the skin. This will help prevent irritation or blisters. Next, position the finger. Place the injured finger in a natural, slightly bent position, usually straight or slightly bent at the middle joint. Avoid forcing the finger into an unnatural position, as this can cause more pain. Now it is time to attach the splint. Wrap tape or cloth strips around the finger and splint in 2 or 3 places, near the fingertip, in the middle of the finger, and near the base. Make sure the tape is snug but not too tight. You do not want to cut off circulation. After securing the splint, check for signs of poor circulation, such as numbness, increased pain, coldness, or color changes. If any of these occur, loosen the tape. If you do not have a splint, you can use buddy taping as an alternative. Tape the injured finger to an adjacent healthy finger for support. Remember to place padding between the fingers before taping to prevent skin damage. Finally, monitor the injury and seek medical help. Keep the finger immobilized and avoid using it. Watch for swelling, numbness, or increased pain. Even if the injury seems minor, it is wise to get a professional evaluation as soon as possible. In survival situations, improvising with available materials is key. Using items like a gift card or a small piece of wood can stabilize the finger effectively until proper care is accessible. The goal is to prevent movement of the injured finger to reduce pain and avoid worsening the injury. Always prioritize cleanliness to reduce the risk of infection and ensure the tape is not wrapped too tightly to maintain circulation.